My name is Michael Recht, and I'm the Lewis Marks Professor and the Chair of the Department of Radiology at NYU Langone. One of the things I think most patients don't realize about radiologists is how subspecialized we are. So for example, I'm a musculoskeletal radiologist, so I look only at soft tissues, bones, and joints. And in fact, my area of research interest is MR of articular cartilage, really understanding why cartilage degenerates, which leads to arthritis, osteoarthritis, and rheumatoid arthritis. So one of the most exciting things of radiology today is that the role of a radiologist is changing. So 20, 30 years ago, the role of a radiologist was really just to make a diagnosis. So we would look at an x-ray, we'd make a diagnosis, but we really didn't have any role in treating the patient. With newer ways of non-invasively or minimally invasively treating patients, we're actually getting involved not only in making the diagnosis, but treating the patients and saving them from more invasive procedures. So for example, there are certain types of bone tumors where it used to be that you would have to go in and have it removed surgically. Now we can often do that by putting a needle under the imaging guidance and ablating or removing the tumor, and the patient can really have this done as an outpatient and go home the same night and really save them a much more traumatic experience. At NYU Langone, we have a full range of radiology services. We have the typical radiology services such as X-ray, CAT scan, MR, but we also have more advanced and state-of-the-art imaging service. For example, we had the first MR PET machine in the city of New York, which allows us to combine an MR procedure and a PET procedure and acquire them simultaneously. And the hope is that we'll be able to combine the information from each of those examinations, which is different, to allow us to determine not only if you have a tumor, but whether that tumor is aggressive. Is that tumor responding to the treatment that your doctor is prescribing, such as chemotherapy? I've always thought of radiology as a puzzle and radiologists as puzzle solvers. So each patient comes down when you're looking at an image. You have to understand what's going on with the patient clinically. You look at the imaging findings and you put all of those clues together to answer the mystery. And that's the most satisfying thing. When you have a situation where people don't know what's going on and you're able to look at the imaging that that patient has, put together the clinical findings, and solve the mystery. Tell the clinician what's going on with the patient, how to treat that patient to make the patient better.